This year in psychology, we learned about all the different disorders like anxiety, depression, personality disorders, eating disorders, mood disorders, dissociative, impulse control disorders, adjustment disorders, and ADHD and OCD. You would never think that the celebrities you look up to would have a disorder, but in this presentation you will find out how common it is.
Anxiety is a feeling of apprehension and fear characterized by physical symptoms such as palpitations, sweating, and feeling of stress.
Barbra Streisand suffers from social anxiety disorder. On one occasion in 1967 New York Central Park concert, she forgot the lyrics to a song. Fear of forgetting her lines again halted her from performing other concerts. Only until 1994, after years of therapy and medication, she was able to sing again.
Depression is an illness that involves the body, mood, and thoughts that affects the way a person eats, sleeps, and the way one feels about oneself, and the way one thinks about things.
Angelina Jolie is reportedly suffering from postpartum depression. The wanted actress, who has 6 children with partner Brad Pitt, is said to be having severe mood swings and is finding it hard to cope after her newborn twins, Vivian, Marceline, and Knox Leon, were diagnosed with colic, a common condition where babies cry excessively for no apparent reason.
Personality disorder is a type of mental illness in which your ways of thinking, perceiving situations, and relating to others are dysfunctional.
Tyra seems to suffer from some form of severe narcissism combined with delusions of Oprah.
Anorexia is a psychological disorder that goes beyond out-of-control dieting, where weight loss becomes a sign of mastery and control.
U.S. Weekly and People magazines reported that Olsen has an eating disorder and entered the unidentified treatment center during the past few days.
A mood disorder, sometimes called manic depressive illness or manic depression, that characteristically involves cycles of depression and elation or mania.
There has been a lot of public questions surrounding the disappearance from the Cleveland Cavaliers training camp and preseason schedule of combo guard Delonte West. The organization for the past few weeks has just said West has been dealing with personal issues. Often this is something organizations will say when a player is unhappy with the organization for one reason or another. However, this is not the case with Delonte, as information is starting to surface that he has been undergoing treatment and counseling for an ongoing battle with depression and mood disorders that he has dealt with since early childhood.
The dissociative disorder are a group of mental disorders that affect consciousness and are defined as causing significant interference with the patient's general functioning, including social relationships and employment.
Herschel Walker's admission that he suffers from dissociative identity disorder should shatter the myth of the flawless athlete once and for all.
Impulse control disorder is characterized by the inability to resist the impulse to perform an action that is harmful to oneself or others. This is relatively new to class of personality disorders. The most common of these intermediate are explosive disorders, kleptomania, pyromania, and compulsive gambling disorder.
Impulse control is a problem for a much bigger star, Mel Gibson, on July 28th when he was pulled over for drunk driving and spewed anti-Semitic comments at the arresting officer.
An adjustment disorder is a deliberating reaction, usually lasting less than 6 months, to stressful event or situation. It is not the same as a post-traumatic stress disorder, which usually occurs in reaction to a life-threatening event or can be longer lasting.
Mary Osmond was one of the first celebrities to speak out about the reality of postpartum depression.
Up to 10 million American adults have attention deficit hyperactivity disorder, also referred to as ADD. It is no surprise that some of America's most acclaimed athletes, actors, and musicians make up part of the mix. Left untreated, the disorder is characterized by poor concentration and disorganized and can lead to emotional and social problems.
The criteria for diagnosis of gender identity disorder. Evidence of a strong and persistent cross-gender identification, which is a desire to be or the insistence that one is the other sex. Evidence of persistent discomfort about one's assigned sex or a sense in the gender role of that sex. Evidence of clinically significant distress of impairment in social, occupational, or other important areas of functioning.
Causes of gender identity disorder. Little is known. Biological causes play a greater role than education and surrounding influences. Effects of gender identity disorder are the patients may become socially isolated or ostracized, contributing to low self-esteem. Males with gender identity disorder may resort to self-treatment with hormones, perform own castration, engage in prostitution. Suicide attempts and substance-related disorders are commonly associated with gender identity disorder.